Hey, how you doing? As with memory, over the years, one can experience changes in vision. The question is to distinguish which are age-specific and which can be corrected. Today we will see how to detect problems in time, what problems and diseases can affect our eyes, and what to do about them. Annual checkups with the optician when we get older are the best way to detect incipient diseases, and to make the appropriate corrections in the prescription of the glasses, if necessary. It must be said that untreated diabetes or hypertension can lead to eye problems. This is how a common health condition can make us dependent, if we do not act wisely. Fortunately, unlike diabetes or hypertension, which can affect the eyes without us noticing it, there are other diseases that make themselves known through clear symptoms, such as sudden loss of vision or dimness, flashes, eye pain, and so on. Let's see if they are symptoms of common problems, or if they point to some disease. Let's see now what problems can affect our eyes. The following 3 problems are quite common and are not usually signs of alarm, with some exceptions. Floating spots are tiny dots or webs that seem to float when we are in a well-lit room, or when we look at the sky on a clear day. It is usually considered a birthday thing, but it can indicate a detached retina. If there are a lot of new floating spots or flashes of light, this is a medical emergency. Excessive tearing may be a person's response to light, wind, or temperature changes. In these cases, sunglasses or eye drops will help. But sometimes this tearing occurs in the absence of such stimuli, because it is the response to an infection or a blockage of the tear duct. A doctor must be consulted. Red, swollen, itchy eyelids that cause tearing and crusting of the eyelashes during sleep may be due to blepharitis. It is usually treated with warm compressors and soft ointments to clean the eyelids. By the way, here is a link to the video explaining how to perform eye care on an older person. Except for the first disease we will discuss, which can cause partial vision loss, the others can result in blindness. At first, they may show no or very mild symptoms, but detecting them early in a checkup leaves ample room for addressing associated diseases. Presbyopia is the slow loss of the ability to see close objects or small print. It is something typical of age, and you can tell because it gives headaches, tiredness or tension in the eyes, and because the person stretches out his arms a lot when reading. With age, the arms get shorter, as some say, because they do not recognize that they see badly. Glasses usually correct the problem. Cataracts are cloudy areas on the lens of the eye that cause blurred or cloudy vision. Some cataracts remain small and do not alter vision much. But when the affected area is important, it's time to consider surgery. It is a safe and fairly common procedure that can make a person look like they used to. Corneal diseases can cause redness, tearing, pain, vision problems, halos. Objects appear to have an aura of light around them. The trigger may be an injury or an infection, and of course, these diseases are more common in older people. Fortunately, the treatments are usually effective, and range from using drops, to surgery, to correcting the prescription of the glasses. Dry eyes are due to malfunctioning tear glands, and symptoms range from itching and burning to some loss of vision. It is also common as we get older, and more frequent in women. A humidifier at home, some artificial tears, some ointment, or even special contact lenses for the most severe cases, usually work well. Glaucoma is caused by excess pressure in the fluid inside the eye, which may go unnoticed at first. If left untreated, it can lead to partial or total vision loss. The best way to detect it is through a regular examination in which the intraocular pressure will be measured, in addition to examining the fundus of the eye with the pupil dilated. Glaucoma is treated with drops, laser or surgery. Retinal disorders are a major cause of blindness. We highlight 3 types. Age-related macular degeneration can affect the perception of details necessary for driving or reading. Apart from the symptoms, it is diagnosed by observing the fundus of the eye with the pupil dilated. There are many treatments for this disorder, including some dietary supplements that may reduce the chance of it getting worse. Diabetic retinopathy develops slowly and quietly, so if you have diabetes, you will need to have your eyes examined at least once a year. Keeping diabetes under control will be the best strategy, although laser surgery can sometimes prevent this disorder from going any further. Retinal detachment, as we said, is a medical emergency and is manifested by new floating light spots or new flashes of light. Through surgery or laser, doctors can prevent vision loss. If, despite glasses, contact lenses, medication or surgery, we can't read street signs, find it hard to recognize the faces of friends and family, or the lights seem dimmer than before, it's time to take the next step, finding accommodations. Of course, you can always use a magnifying glass with a light to perform static tasks, such as reading or doing a puzzle. If you read on an electronic device, you can make adjustments designed to improve accessibility, which enlarge the letters, improve contrast, or even read aloud by us. Another thing that can be done is to improve the lighting. You can use large black felt tip markers and paper with large lines. If there are steps, it is a good idea to install tapes that highlight the edges, and thus prevent falls. The switches and plugs should contrast with the color of the wall. Or even better, if we have the possibility, to install motion sensors to turn on the necessary lights, so that they do not turn off inappropriately. And of course, it is a question of enlarging the watches, the calendars, removing obstacles, in short, doing everything possible to maintain maximum autonomy. And so far for today, I hope I've been helpful. Thank you very much, and until the next video.